Methods to procure safe abortion. Manual vacuum aspiration. Pregnancy can be ended by this method up to 10 weeks gestation. Also called menstrual extraction, mini section, early abortion. The content of the uterus are suctioned out through the thin plastic tube that is inserted through the cervix and suction is applied by a syringe. The procedure usually lasts for about 15 minutes. Sedation and anesthesia are not required. Procedure is 99.5 effective in terminating pregnancy and is associated with a low risk of complication. Menstrual extractions are safe, but because the amount of fetal material is small, so at this stage of development it is easy to miss. This may result in an incomplete abortion. Dilatation and curettage, suction curettage, also called as a dilatation and curettage, suction dilation, vacuum curettage, or suction curettage. The procedure involves a dilatation of the cervix with a series of dilators. The contents of the uterus are then removed with a tube attached to a suction machine, and walls of the uterus are cleaned using a curette. Advantages using done as 1 day outpatient procedure takes only 8 to 10 to 15 minutes. Bleeding lasts 5 days or less. Disadvantages: the procedure is invasive. Surgical instruments are used. Infection may occur. Procedure is 97 to 99% effective. The amount of discomfort a woman feels varies considerably. Local anesthesia is often given to numb the cervix. It does not mask uterine cramping. After a few hours of rest, the woman may return home. Dilatation and evacuation. For second trimester abortion, the procedure is similar to those used in dilatation and curettage, but a larger suction tube must be used because more material must be removed. This increases the amount of cervical dilatation necessary and increases the risk and discomfort of the procedure. Other surgical methods, surgical procedures for second trimester abortion, although rarely, are used. Dilatation and extraction, D and X. The cervix is prepared by means similar to those used by dilatation and evacuation. The fetus, however, is removed mostly intact through the head must be collapsed to fit through the cervix. The procedure is sometimes called a partial birth abortion. Induction: cervix is dilated. Drugs, usually prostaglandin or salt solution, are injected into the uterus to induce contraction. The fetus is delivered within 8 to 72 hours. Side effect: nausea, vomiting, diarrhea from the prostaglandin and pain from uterine contraction. Pain can go home a few hours after the procedure. Hysterectomy: a surgical incision is made into the uterus and the contents of the uterus removed through the incision. The procedure is generally used if induction methods fail to deliver the fetus.